Okay, so this webinar is all about understanding the current COVID-19 outbreak, and by that we mean understanding the outbreak from more than just a health perspective. So right now this outbreak is obviously having huge health impacts, but it's also creating really huge political, economic and societal challenges all across the world. So we felt that this was a very timely opportunity to talk about the many issues that we're facing in situations like this, and how outbreaks are about more than just health. So as I say, for students who are online, most of you will be used to Zoom by now, but essentially part of this session will be a presentation, and then we'll move into a Q&A session. So at the bottom of your screen, you should have a Q&A function, so please feel free to type questions into there. And if you have any other issues with Zoom or want to talk to us about anything else, then you can also use the chat function, which is at the bottom of your screen too. So to introduce ourselves, I also realised that I haven't introduced myself yet. So my name's Danny, I'm one of the tutors in the School of Public Health, and I work mostly on our Global Health and Development undergraduate programme. So we have Professor Keiji Fukuda, who is the director here at the School of Public Health. He is the former Assistant Director General for Health Security at the WHO, and he has worked on many outbreaks in the past, like avian influenza, SARS, pandemic influenza, Ebola and MERS. And then we also have Dr. Ryan Young, who is the Deputy Programme Director for our Bachelor of Arts and Science in Global Health and Development. And he will talk to us a little bit later about that programme and some of its key features. So as I say, Professor Fukuda will take us through the main part of the discussion, and then we'll open up for a Q&A session where we'll take questions from the Q&A function on Zoom. So I think with that, we'll get started. I'll hand over to Keiji and we can get started with the presentation.
Great, thanks Danny, and welcome everybody, and thanks for joining us. As Danny mentioned, this is really a dialogue, and so I just have a few slides. This is not going to be a lecture, but I did want to help set the scene so you have some context, and then we're really looking forward to any questions that you have that you want to discuss about the COVID-19 situation. And then afterwards, Ryan is going to inform you about the Bachelor of Arts and Science program that we have, which begins to tie together many of these things in a more educational and programmatic way. But let me get started first with this background on the current COVID-19 situation. So the first thing I wanted to simply point out is that throughout human history, we have had major outbreaks of infectious diseases, and you know, the terminology which is often used is now emerging infectious diseases. So if we go back to the last, 4 or 5 decades, I've just put down some of the more famous ones that have come out. But if you go back to the 1970s and 80s, was the period when we saw the emergence of human immunodeficiency virus, HIV, which causes AIDS. We've had outbreaks of avian influenza, which has been the virus that we've probably been most concerned about for the last few decades. In 2009, we had a pandemic of influenza, and then we've had various outbreaks of coronaviruses. So SARS back in 2003, we had the emergence of the Middle East respiratory virus, or MERS, in 2012 in Saudi Arabia, and then we have this COVID-19 situation, which we'll focus on. But in addition, I think all of you probably remember a lot of news about Ebola in the past few years, as well as something called Zika virus. I simply want to make the point that all of these outbreaks have unique features. None of them are exactly the same as any others, and some of them are quite different from others. But perhaps more importantly, they all share common features that I want to highlight. So in looking at these kinds of outbreaks, and there are many different kinds of outbreaks. They can be caused by fungi, they can be caused by bacteria, but these large ones which make the world concerned about whether we're going to see international spread largely have been caused by viruses. And all of them have emerged from animal reservoirs. And so some of these viruses have resided in wild birds or in swine like pigs. Some of them have resided in primates in Africa. Some of them have been emerged from camels, and others have emerged from reservoirs of bats going through intermediary animals like civets. When these viruses emerge, they begin to adapt to people. And so through genetic mutations, they become viruses which more easily infect people, and then importantly, are able to transmit from person to person. And it's the person-to-person transmission which allows these viruses to cause big outbreaks which can cross borders. And so all of these outbreaks, which I've mentioned previously, have had some degree of international spread, ranging from a small number of countries up to virtually the entire world. Now, many people think of outbreaks as the spread of an infection or a disease, but in reality, outbreaks are probably better thought of as these phenomena where we see the spread of many things. It's not just disease and infection, but it's things such as surprise and confusion, anxiety, and fear. So if we look at the social aspects of these outbreaks, one thing which is almost invariable is that we always are taken by surprise. And when we're taken by surprise, there's always some level of confusion followed by anxiety and fear. If we look at how countries respond, how a country in Asia may respond may be quite different than how a country in Africa or North America or Europe responds. So we see a lot of variability in national responses. Now, one of the main roles for WHO is to help the world get through these large outbreaks. And in that role, it has multiple functions, but two that I want to highlight is that it plays a very real role in global coordination. So in terms of the flow of information, in terms of the provision of support or expertise to countries, WHO plays the coordinating role in the world. It's also probably the information hub that everybody goes to. Certainly you can go to it for things such as numbers of cases, but if you're a technical person and you want to understand more about the vaccine or so, it's probably the single best place to go to. So it has a very central role as an information hub for the world. Now, one of the things which is also true, however, is that part of the reason why these outbreaks cause so much disruption is that we're simply not ready for them, and we have a lot of vulnerabilities. The most fundamental one is that in many ways, countries are chronically not prepared for them. In some instances, the population does not trust the leadership of the country, and we're in an era now where we have both too little and too much information. People are often worried that things are being covered up or not being shared. On the other hand, people are also very confused because there's so much information coming through social media, through the internet. A fourth kind of issue is that we have systems which are often inadequate to meet outbreaks. And so if there's a big upsurge in the number of patients, we may not have enough beds or respirators or healthcare workers. And the systems that we have in the world are often not highly adaptable or cannot really scale up to meet these emergency demands. We often have shortages of materials, so face masks or personal protective equipment. We may not have enough healthcare workers, and we often simply don't have enough expertise spread around countries. One of the direct consequences of all of this, is that it has a depressing effect on countries. It's very expensive to have an outbreak. You have a lot of costs that you have to cover up, but it also tends to depress tourism, depress business. People go out less often, And so the economic impact is quite severe. And then finally, these outbreaks also have the really unfortunate effect of stigmatizing groups of people. So it's very easy for countries to highlight that infection started in one country or another, but that gets translated into that group of people is to blame or so on. And these can lead to a lot of examples of stigmatism or ostracism or racism. So if we look through history and we ask ourselves, well, how bad can these things get? In the current situation, if we look over in the left-hand column, we see that in mainland China, we have approximately 80,000 cases which have been reported as of, I believe, today, and about 3,000 deaths. And then if we look at the other countries that have now reported infections by COVID-19, we see that there's about 15,000 cases and almost 300 deaths. And so a large number of countries, 85 countries. And so this is 85 countries in the span of about 2 months. So it gives you a sense of how quickly this can spread. But if we look at past outbreaks, we get a sense of how large they really can become. So in 1918, there was a pandemic of influenza. And this is probably the most devastating pandemic or outbreak in human history. And so that outbreak infected approximately 500 million people. And so I think that was about a third of the world's population at the time. And it's estimated to have caused at least 50 million deaths over the span of a year. If we look at the 2003 SARS outbreak, of which Hong Kong had a lot of direct experience, that was about 8,000 people and almost 800 deaths, so about 10% mortality. And then if we look at the most recent true pandemic, in 2009, we had an influenza pandemic of a virus called H1N1. We see that it's estimated that there was about 700 million to about 1.4 billion cases, and somewhere from 150,000 to about 500,000 or 600,000 people who died. So if we look at the current situation in Hong Kong now with the current outbreak, as of yesterday, today I believe, there were 105 cases that were reported. And these are cases that occurred between the middle part of January up until the last few days. And in this slide here, you can see an epidemic curve, which is provided by the Center for Health Protection, CHP, in the city on a daily basis. And so it's updated. And what you can see is that it's composed of a number of different colors. But let me walk you through this curve. You can see that the first cases occurred in the middle part of January. And by the end of January is when we had the highest number of cases occurring over a couple-day period. And then you can see that it's remained, there's been a kind of, downward trend in cases, but it's been relatively steady over the past few weeks. The other thing to note is that these cases are colored in different ways. So the blue cases represent infections in people who traveled from elsewhere into Hong Kong. And then some of the other boxes represent people in Hong Kong who were close contacts of those known cases. But of all those boxes, the ones which I look at most closely are the red boxes. These are so-called community cases. So these are cases occurring in Hong Kong for which it's not clear how they got infected. So one of the concerns about any outbreak is whether you're going to see a large explosion in community cases. So that would be the red boxes. But you can see it's sort of a smattering pattern. So we have cases occurring, a few a week or so. But over the entire period, the number of cases per day is on average a little over 2 cases per day. So this is actually quite a low number of cases for a population of over 7 million people in Hong Kong. So if I make a couple of observations about what we've been experiencing here in the last few months. I think I'd point out these aspects. One, because Hong Kong has had a lot of experience with bird flu, with regular influenza, with outbreak like SARS, the foundations in the city are actually quite strong. And by that I mean that its ability to make decisions about what to do, its scientific foundations and its public health foundations are quite strong. The health department is actually very competent in dealing with these kinds of outbreaks. The second thing is that a number of different actions have been taken. So there have been basic public health actions like conducting surveillance, trying to keep track of how many cases, investigations of people who are sick and their contacts. There have been a series of different measures to close down the border to different extents over time. There has been a reduction in travelers coming in from infected areas such as mainland China. And there has been a significant amount of quarantine which has been done on people at risk of infection. There has been a strong emphasis on reducing the mixing of people, or so-called social distancing. Strong emphasis on things like personal hygiene, so wearing masks in certain situations, washing your hands frequently, and then a lot of communications. And then the other thing I notice is that there has been a huge engagement both by the media, by social media, and by the public in general in the outbreak. So some of the consequences, I think, of these actions, or some of the other observations about the public in general here, is that, in reality, we have had very few cases, and it's been an increase of a couple every so often, but I'm actually quite surprised that we've had such a low number of cases. The second thing, however, is that it's clear that this outbreak takes place in the backdrop of the demonstrations and the social divisions which were highlighted in the past year. And this has led to a high level of distrust of the government. We've seen this play out in terms of actions like the healthcare worker strike, in terms of media commentary, and so on. A third important aspect of the outbreak in Hong Kong is that there is a fair amount of confusion about what to do, a fair amount of anxiety and fear. And we've seen this manifested in a number of different ways. So proposed quarantine sites, for example, have been set on fire. There have been shortages of toilet paper and paper products and masks. And if you simply walk on the streets over the last few months, you've seen that they are much quieter than normal. A fourth aspect that I want to point out is that in reading about the outbreak in the newspapers and in social media, I see that there's a lot of mixing and blurring of issues. And so the outbreak itself has become mixed up with a lot of the issues and background trends in Hong Kong. And then finally, I think that it's very clear that the impact of both the demonstrations that we've had last year, as well as the outbreak this year, does have a high economic and, I think, emotional impact on the population. So I think, Jeff, that's, so that's some background of how I look at the outbreak in Hong Kong. I think importantly, there are some questions going forward. We are right now somewhere in the midst of the outbreak, but we do have to look ahead. And I think one of the key questions is, how is Hong Kong going to return to normalcy? How is it going to go back to how it normally is without increasing the risk of the outbreak taking off again? And I think this is going to be a challenge for Hong Kong, as it will be for many countries, if the outbreak continues to spread internationally, so that there's disease and infection going on in other countries, but it's relatively quiet here. I think a second question is that I think it's clear that all of us in Hong Kong are hoping to see the city return to as normal a state as possible. And so what is it that different sectors and different individuals can contribute towards? But I think the long-term issue for Hong Kong is that having gone through this experience, how can it be better prepared for the future? So these are some of the questions that I ask myself in looking forward. So let me stop here, and you can take any questions that you want to pose.
Okay, so I think we have quite a few questions already. So there are a few people submitted questions beforehand, and then I can see that we've got a few on the chat already and a few more coming in. So let me just try and go through these. Okay, so we've got a few questions about sort of what we can learn from previous outbreaks. So what can we learn from previous outbreaks in terms of government and WHO responses in the past? Would you like to take?
Yeah, sure. So let me start with that. I think that among the main lessons that we can learn from is that it's really critical in an outbreak and crisis situation for organizations like governments and WHO to move quickly. People's anxieties, people's fears transmit around the world very quickly. And so acting quickly is important, but also getting information out quickly is important. It's the basis, an important part of the basis for trust. And so being transparent, being open with information, saying you don't know when you don't know is critical. We also know that there are a number of different actions which should be initiated immediately, such as the development of vaccines, work on medicines, and those sorts of things. But I think these are some of the lessons that we've learned over and over.
Okay, so I'm going to try, we've got a few questions that are quite similar in nature, so I'll try and sort of group these questions up together. So we've got a couple of questions about the use of masks. So there are questions about sort of European culture of wearing masks when you're sick and staying at home. And why sort of certain countries like the US and Singapore potentially emphasize that there isn't a need for people to wear masks, but then in other countries we see that this is promoted. So why is this?
Sure. To provide some backdrop to this, I think it's important to realize there are certain personal measures which virtually all health authorities in the world agree upon. So for example, no matter where you go, there will be an emphasis on washing your hands. There will be an emphasis on, if you are sick, stay home, try not to expose others. And so those kinds of actions, I think, are agreed upon by everybody. Masks are an interesting situation. There are some instances of mask use where, again, everybody will agree upon. So, for example, they are part of the personal protective equipment that healthcare workers must use when they're dealing with infected patients. Secondly, I think that there's no controversy about whether to wear masks if you are sick and you're coughing and you're going to go out. It's a really good way to prevent infection from spreading to other people. But where you do see differences among countries and cultures is on the use of face masks by people who are healthy, particularly when they're out and about with other people. And I think that part of the issue is that the science in this area is simply not conclusive. You know, science in many other areas is much more conclusive, but when it comes to face masks being worn by people who are healthy, the science is not as strong. And so there are simply cultural differences. In Asia, no matter whether we're in Hong Kong or in mainland China or in Japan or Korea, people will wear face masks much more readily and much more often. And whereas if, you know, I grew up in the US, but spent a lot of time in Europe, culturally, people simply do not think about wearing face masks, particularly if they're feeling healthy. And so I think this simply reflects a difference in culture, and we see this played out particularly with face masks.
Okay, so we have a couple of questions about the media response. So this one really sums it up quite nicely. So do you think that the media response to the current outbreak has been overly fear-mongering or potentially inappropriate at times with regards to misrepresenting facts?
I think that whenever something large and fundamentally important to people like an outbreak occurs, media, of course, is going to be all over it, and they're going to be paying a lot of attention. And there are a lot of people in media, and also people in media follow social media. They're on Twitter, they see what other people are doing. And so the response is always going to be quite exuberant, you know, and I think that we see all kinds of stories. I don't think it is purposefully fear-mongering, but I do think that, you know, media does want to get as much attention as possible. And so they may play up different aspects of what's going on. But to tell you the truth, I don't think the response of media to this outbreak has been all that different to the other outbreaks that I've seen in the past. I think what is more different is probably the social media side. It's just much more prominent than before.
So that actually leads quite nicely onto the next question. So we have a few about social media, and maybe had a couple before, a couple of people submitted these sorts of questions beforehand. So do you think the pros of social media outweigh the cons for this situation? And I think maybe more in generally, how do you think that the increasing presence of social media has influenced the management and control of outbreaks?
This is a fundamental question. I will say that the emergence of social media has been a paradigm change in the management of virtually everything, certainly outbreaks, but virtually everything. And I don't believe we fully understand social media right now. I don't think we understand how to use it optimally. That the fact that it is extremely influential is clear. But I think that it represents, it's almost like a wild horse. You know, it has a lot of energy, it has a lot of horsepower, but we're not quite sure what to do with it or how to use it. I don't think it's possible to answer, do the pros outweigh the cons? I wouldn't even know how to evaluate that right now. I do think it's a fact of life, and I do think that social media is going to become increasingly prevalent and increasingly prominent in the future. And I think the real issue is not do the pros outweigh the cons, but how can we begin to understand it, and how can we reduce the confusion it creates, and how do we maximize the immediacy and the value it brings in transmitting important information.
Okay, so we have a few questions about how we can sort of better prepare in the future. So how can we improve our prevention methods and be more prepared for future outbreaks? And we also have questions similar to this in terms of the differences between high-income countries and low-income countries.
Okay, I think this is probably the most fundamental question related to outbreaks. I think it is inevitable that, at least for the foreseeable future, we are going to see outbreaks occur. And some of those outbreaks are going to be the result of new pathogens that we don't even know exist right now. And much of the reason for that is that we have a larger global population, we have larger populations of domesticated animals, but how we are using land worldwide is changing radically. And that combination of factors means that we have more people coming into more contact with animals in new situations. And this is the engine for new viruses to appear. So in terms of how do we be better prepared for it, I think, again, there's a couple of fundamental ways that we have to think about this. Previously, you know, when I used to work in WHO and CDC, we often thought of pandemic preparedness as working on planning and developing contingency plans and working on things like surveillance. But in fact, I think we have to be working at a much more fundamental level. In my experience, the countries which have done best with outbreaks are the ones which have pretty strong health systems, so that they have systems which can scale up, they have systems which can be adapted, they have good decision-making systems, they have good communication systems, and so that no matter whether it's one virus or another virus, or even a completely different kind of emergency, it's able to adapt to the situation. I think the second fundamental issue is that it simply costs a lot of money to really be prepared. And in the periods in between outbreaks, we frequently lose political momentum. People don't care about the outbreaks, think it's past, and they can go back to regular business. And so funding is not provided for preparedness. I think that's the second major issue. But I think the third major issue is that there are some cultural sensitivities which eventually have to be looked at. So for example, in Hong Kong in 1997, when H5N1, one of the bird flu viruses, appeared, it appeared because there were live chicken markets in Hong Kong. And it was one of the ways in which people came in contact with this virus. And similarly with SARS and with this COVID-19 virus, we have seen that it probably emerged from wild animals, but the way that it got to people was through the selling of wild animals in live markets. And so these are cultural practices and so on. And so whether we can make a cultural change so that the risk for that kind of transmission goes down, I think is one of the challenges for societies. And so I think that these are all fundamental steps which need to be considered and potentially acted upon in order to really get us better prepared for the future.
Okay, so we have a couple of related questions here in terms of how long do you think that the outbreak will be sustained for, and whether the environment and climate play a role in the spread of the current outbreak?
So here I think we have to ask ourselves first, what do we mean by the outbreak? If we mean how long will this virus be around, it's possible that this virus could be around for many, many, many years. We simply don't know that. This could be the emergence of a pathogen which is going to become a human pathogen and be circulating, you know, for decades, if not longer. But if we mean the outbreak in terms of this intensified period of response and doing things like social distancing in a way that is different than how we normally conduct our lives, hopefully that within the next year or so, most countries will be able to return to a state of normalcy. I think in Hong Kong right now, for example, even though we have ongoing cases, there is a concerted effort about how do we bring people back to school, how do we bring people back to work, how do we bring businesses back into a normal, much more normal level. And certainly those discussions are going on in mainland China and being acted upon. And I think that all countries in the world that get affected by this to a significant degree are going to go through the same process as we're going through now. Worldwide, I think that this kind of process can take, several months, a year or so. I think those are probably reasonable guesses.
Okay, so we have a couple of questions about susceptibility of this virus in different age groups. So we have a couple of questions about susceptibility in children, and if this were to turn out to be higher than we had originally thought, what would this mean for protecting children?
Well, one of the features of this infection and this outbreak that we've learned so far, and this comes mainly from the observations made in mainland China, looking at a large number of cases there, is that the risk for severe disease changes by age. So people who are older are much higher risk for severe disease. And also people who have chronic conditions like heart and lung diseases or hypertension. And again, an interesting feature is that among the age groups that were infected, children are not a large percentage of that population. So one of the questions right now is that, are children getting infected but are not getting very sick, so they're not being identified as cases? We are going to probably need to do more studies, and specifically serologic studies in the population, to get a better idea of what is the true infection rates in different age groups. If children are getting infected, then they could be a major driver for how infection spreads from person to person. But if by contrast, for whatever reason, they simply are not getting infected at very high rates, then it's being driven by the older age groups. So these are simply facts about the epidemiology which we're not clear about right now.
Okay, so we have a couple of similar questions that I'll try and sort of put into one question. So a couple of questions about government responses and closing of borders. So obviously there's a lot that governments need to consider in these types of situations, and sort of balancing national interest and international cooperation. So closing borders, for example, has been one thing that we've seen quite frequently in the news. So what are the sort of main things that government need to consider when making these types of decisions?
In my experience, virtually all governments try to weigh the domestic interests and also the international interests. But in the end, what they feel is important for the domestic population is the primary factor in making decisions. And so, for example, when countries have made decisions to close borders, or if areas have made decisions to close borders or to restrict the entry from certain countries, these have been made on the basis of trying to reduce the entry of infection into the population. And this is largely driven by the desire to keep infection out of the country. If you look at the international recommendations, such as those coming from WHO, they in general have not recommended travel restrictions at all. But nonetheless, countries have made those decisions, or areas have made those decisions to go ahead. There is a double-edged sword to all of this. On the one hand, you can keep infection out, or you can reduce it to some extent. It's probably impossible to keep infection out unless you stop all travel. But also, as you can see, the penalty for decreasing travel, for closing borders, is also quite high. You depress business, you depress travel, and you begin to make countries feel more isolated. So it's really a very difficult situation. But in my experience, again, it's primarily the domestic considerations which drive those decisions.
Okay. So we've got lots and lots of questions, lots of really good, interesting questions, but we are quickly running out of time. But I think we've probably got time for at least one more, and then maybe we'll see how we're going. So we've got a question about sort of communication and collaboration between. So I guess sort of in a similar vein to the last question. So is there effective dialogue between public health organisations and international relations, international organizations maybe, to improve knowledge and understanding?
I think that in this outbreak here, we've probably seen more scientific studies done in a short period of time than we've ever seen related to any outbreak. So this represents a tremendously high concentration of collaboration, at least among scientists. On the other hand, we have also seen a lot of criticisms that key information has been made available too late and not quickly. And so this also represents a situation in which the expectations of the public and of other countries are not being met. In my estimation, I think that we are seeing a high level of collaboration among the organizations which usually collaborate with each other, so public health organizations and the different scientific organizations. But I do think that there is also a sense that we are not getting all of the information which is available and which is wanted. So I think it's more than glass half full, but it's not a fully full glass.
Okay. So we've got some more questions about misinformation. So how do you think that, oh, sorry, I've lost the question. Here we go. How has fake news or misinformation affected the world's progress in containing this pandemic?
I think when we see misinformation, it can have various effects. You know, one of the most immediate is that it simply creates a lot of confusion. Different rumors from different people saying different things simply makes people more confused, more cynical. Some rumors, when they take hold, can have direct impact. And so we have seen the impact of rumors on the available supply of things such as paper products in Hong Kong, hand sanitizers, and these shortfalls in supplies are being repeated in other countries. And I think these are really the results of both misinformation, fear, rumors, and those sorts of things. So I think that the cumulative impact, again, is hard to quantify, but it certainly makes it a more uncomfortable situation for the general public, and it can make it much harder for health authorities to ask people to take certain actions because you know, other people may be arguing against those same actions. So it, at the very least, causes confusion. At the worst, can make it impossible to implement important public health actions.
Okay, so we have another question here. How do we judge a nation's successfulness in controlling an outbreak, either in this instance or in previous instances? And given this criteria, would you say that Hong Kong is on the right track?
I don't think there's a single metric for judging how well a country has done in terms of an outbreak, because to be fair, you really need to look at what is the, where is that country starting from? So having been involved in outbreaks in Africa where the health systems are much weaker, I don't think it's fair to compare that with countries in which the health systems are much stronger. However, having said that, even though there has been a lot of criticism within Hong Kong, having worked in Hong Kong, you know, since the late 1990s in various outbreaks, I think Hong Kong is one of the areas in the world which has really learned from events in the past, built upon them. I think the foundations are strong here. I think the general population is quite knowledgeable about outbreaks. Many people here still remember SARS. And so I would say this is one of the places in the world which has really done a lot to respond well and to prepare itself.
Okay, so I think given the time, it's already past 1:15. So I think we'll wrap up there. We've had lots of questions, and I'm sorry that we haven't managed to get to everyone, but I hope that I've sort of summarised most of people's questions and covered most of the key topics that people wanted to know about today. So I think we'll move on now to Ryan, who is going to share a sort of really brief presentation just about our Global Health and Development Programme and how our programme sort of links in with the whole with this whole situation. So I'll hand over to Ryan now.
All right, thank you very much, Danny. So these are essentially the things that I prepared like some days ago, and it actually matches with what we just discussed. So how does, say, an outbreak, which people might perceive as a health issue, impacts other disciplines? For example, news has been asking like what coronavirus could mean for global economy. How are we going to deal with fear amongst the, say, citizens in Hong Kong or elsewhere? I mean, are we going to just condemn them, or are we going to do some remediation work in order to solve these issues? So how are we going to make decisions with regards to, say, school closure or like prohibit like movements of people within society? And I mean, we also discuss things like how should, say, people from different sectors cooperate with each other. For example, in a recent editorial in a leading academic journal, they actually said like maybe the economists and scientists should work together to solve all these societal problems. And obviously, when we talk about, say, policies, I mean, it's not simply based on evidence. Of course, evidence plays a major role. But of course, I mean, when we make political decisions, I mean, obviously, there will be different things that the government has to consider in order to arrive at a consensus which is agreeable amongst all different stakeholders. For example, whether we should postpone the Olympic Games in, say, Tokyo. And obviously, that's a decision that is very difficult to make, and it requires a lot of the input from different sectors in order to arrive at a thing or a decision that is feasible and considered as appropriate. Okay. So that's why, Hong Kong U has launched the BASC program, and we are the ones that are looking at global health and development. So essentially, this BASC GH program is an interdisciplinary program which involves curriculum design from 6 faculties. So we will use different modes of education, not only just lectures, but also tutorials, problem-based learning, such as, for example, COVID-19 or like climate change situations or case studies, to elucidate the importance of, say, health and development and how they interact with each other. I mean, when we consider these issues. Of course, I mean, Keiji and Daniel has already discussed like issues that are not just primarily knowledge-based, for example, like leadership and how are we going to advocate like policies. I mean, obviously that requires training in what we call soft skills. As most importantly, I mean, it's better to really go out into the field to understand how things actually are decided and done. So that's why in our program, one of the very unique feature is the overseas field placements arranged by us. So students will have the opportunity to go to, say, supranational institutions or organizations like UNICEF or WHO to understand how things actually work in practice. So some people might ask, okay, what are we going to learn from this BASC GH program? So we will be talking about like concepts and knowledge that surrounds global health and development. And essentially that's some of the points has been already been covered by Danny and Keiji. For example, like how does, say, global health and development issues impact economics? What is the role of law? I mean, in terms of, say, doing all this regulation, what is the role of public health? Well, why do we need epidemiology to understand the situation in Hong Kong and elsewhere? So you see a lot of papers published in academic journals about like what is the spread of the disease? Is it human to human transmission? What is the incubation period? What is the case fatality rate, so on and so forth? So these are the public health aspects. And of course, when we talk about public health, you also need to understand statistics because that measures the uncertainty with regards to our estimates. And obviously, we are dealing with society, so you have to also understand things like population development and also global political economy. And as we mentioned earlier, I mean, apart from this knowledge, you also have to, you also learn things like competencies, like how you're going to lead, say, a group in tackling a global health and development issue, how you're going to advocate policies. And lastly, of course, we will also cover relevant topics like health systems, innovation technology, what is the role of private sector, as well as seminars. And obviously, COVID-19 will be something that we are going to talk about in senior courses. So this is just the standard BASC GH curriculum, similar to your other undergraduate program. This is a 4-year course. And for the first year and the second year, you'll be learning things that are more knowledge focused. So meaning that you're learning the foundation blocks from different disciplines that are relevant to global health development. And from year 3 to year 4, you'll be doing courses that are more topic specific, meaning that you're dealing with like more complex issues. For example, how do we have health system which is sustainable and strong enough to counteract, say, outbreaks, for example, like the COVID-19 event that we are seeing right now. And of course, there will be overseas field placements that's going to happen after year 3 in summer till the first semester of year 4, so that you actually gain like practical experience and know how these things are actually translated from knowledge that you learn from the curriculum into practice. All right, so as I mentioned earlier, the overseas field placement is one of the core issues here. So the purpose is to gain exposure to real-life GH challenges and to put theories into practice. And more importantly, you can gain practical experience from mentoring from, say, organizations that you can see on your right-hand side. So you have UNICEF, UNDP, WHO, and so on and so forth. So different organizations will have their own different like emphasis, but I'm sure that these are the things that are very important, I mean, in terms of GHD arena. So I think that's just a very short description of the GHD program. For those who are more interested in knowing what exactly is this program, you can actually scan the QR code on the screen, or you can just email us or contact us by phone. So thank you very much. We know that social media is so important, so that's why we also created our own social media, so as to promote like things that are relevant to the program, but as well as other things that are very, very relevant to GHD, in particular the COVID-19 issues here. So if you have any questions, please feel free to use the text box, and then we are more than happy to answer them.
Okay, so if anyone has any questions specifically about this Global Health and Development Program, we'd be more than happy to take them now. I think we still have more questions about the outbreak. So if we don't have any questions specifically about the program, if you want to know, if you have questions but don't want to ask online, or if you want to know more otherwise, please feel free to either get in touch with us or follow us on social media. We've got lots of videos, different materials that you can have a look, find out more about the course that way. And if we don't have any questions coming in, I think we'll wrap up there. So thank you everyone very much for joining us. I hope you found it interesting, and thank you from all of us. Bye.
Bye-bye.